Did you know chromosomal abnormalities like trisomy contribute to the leading cause of infant death in Canada? Edwards syndrome is the second most common type. We already know trisomy happens when non-disjunction occurs in either two divisions of meiosis. In this case, a third copy of chromosome 18 is present. There are three types of Edwards syndrome: full, mosaic, and partial. So, what makes it happen? Trisomies happen purely by chance, meaning it can happen to anyone around the world, and there isn't much a parent can do to prevent having a child with trisomy 18. We all know that the one factor that could contribute is maternal age. Mothers aged 35 and over have a higher chance of having a baby with Edwards syndrome. Scientists are speculating that other factors possibly contribute to trisomy 18 as well, as these trends surrounding season and environment have been noticed. Edwards syndrome results in health problems involving almost all organ systems. 63% of those diagnosed prenatally do not survive to birth. Babies that do survive will appear small and frail. There are many symptoms that vary greatly between each individual. Some of the more common ones include severe developmental delay, cleft lip or palate, and feeding problems. There's a 95% chance of congenital heart disease in individuals affected. Sadly, the survival rate is low. Only 13% born with the syndrome live past their birthday. Less than 10% of children can survive to their teenage years with significant medical and developmental problems. The major causes of death include cardiac failure, respiratory insufficiency, feeding difficulties, and increased susceptibility to infection. Why do these things happen? The extra chromosome 18 present in cells disrupts normal development. This poor fetal growth and development results in severe phenotypic consequences that usually make long-term survival rare. For example, poor fetal growth and development can lead to a malformed heart, which leads to congenital heart disease like atrial septal defect. You're probably wondering if there's a cure. There isn't. Treatment of the syndrome is provided based on each symptom. For example, if an infant has a cleft lip, they can undergo a correctional procedure to improve it. Surgery can often be used to treat symptoms. However, some will be considered too invasive and would not be recommended as it could shorten the infant's lifespan by even more. Therefore, treatment often involves palliative care. Western medicine is mostly used to treat symptoms of this condition. People can also choose to use other methods, such as Chinese or homeopathic medicine. Developmental delay can be treated with physiotherapy, occupational therapy, and special education. Support groups are available for parents who are struggling or want to learn more about their child's condition as well. Currently, researchers are looking into more cost-efficient, less invasive ways than amniocentesis to screen fetuses for trisomies. Scientists have also recently researched how surgeries affect individuals with trisomy 18. This study shows that undergoing surgery would most likely be helpful rather than harmful. We have such fancy technology. How come there still isn't a cure? In recent studies, scientists have come up with a possible gene editing technology as a potential therapy for trisomies, including trisomy 18 of course. Through chromosome deletion, the extra copy of chromosome 18 can be deleted or silenced in the zygote, leaving the individual with the normal two copies. This idea comes from research done to find a cure for trisomy 21, where an inserted gene's RNA can silence the genes of the extra chromosome. Scientists say that this general strategy could be extended to study other chromosomal disorders such as trisomy 18. To sum it all up, a little mistake in meiosis can result in Edwards syndrome, but there's hope for a cure.